world of medical testing, there's this quiet revolution happening. On one side, you have these new, lightning-fast bedside tests, and on the other, the tried and true central labs that have been the backbone of medicine for decades. So, who's gonna win? Or is that even the right question? Let's dive in. So let's just get right to it. Is this the end for the big, powerful central labs? That's the question we're tackling today. You know, it really feels like this ultimate showdown, the speed of the newcomer versus the precision of the established champion. All right, first up, let's talk about the challenger, point-of-care testing. This is the scrappy newcomer that's all about one thing, getting answers and getting them fast. So what does this actually mean? Well, it's pretty simple. It's all about bringing the lab directly to the patient. Just imagine getting critical results right there at the bedside, or in an ambulance, or in some remote clinic hundreds of miles from the nearest hospital. We are talking minutes here, not hours or days. But why does this matter so much? It's not just about convenience, not at all. In a critical situation, like a potential heart attack or a nasty infection that's moving fast, those minutes you save, that can literally be the difference between life and death. It gives doctors the power to make instant decisions and completely changes how they manage care right there, in the moment. Okay, so speed is a total game changer, no doubt. But it's not the whole story, not even close. So let's flip the coin and talk about the incredible, enduring power of the central lab. Why has it been the gold standard for so long? You know, if point-of-care testing is that nimble little speedboat zipping around and getting places fast, then central labs are the aircraft carriers of the diagnostic world. These are massive, specialized facilities built to handle an unbelievable volume of tests with just mind-blowing precision. They really are the bedrock of any complex, high-stakes medical investigation. So here, it's all about depth and absolute certainty. Central labs run those incredibly complex, specialized tests for things like rare genetic conditions or really subtle cancer markers that are just impossible to do at the bedside. They operate under these ridiculously strict quality controls, making sure every single result is as accurate as humanly possible. And hey, when you're running thousands of tests a day, they become incredibly cost-effective. Let's just put them side by side for a second. It's pretty clear, right? Point-of-care testing absolutely wins on speed and immediate access. But central labs, they completely dominate in sheer volume and complexity. You wouldn't use a quick bedside test to map a genome, and you definitely wouldn't send a sample to a central lab when a patient in the ER needs an answer in the next 5 minutes. They're just different tools for different jobs. So, if they're both so good at such different things, maybe we've been asking the wrong question this whole time. What if this isn't a battle for supremacy at all? And this right here is the key takeaway. We're not witnessing a replacement, we're witnessing an evolution. The future of diagnostics isn't about choosing one over the other. It's about making them work together, smarter than ever before. Picture this. A patient comes into the ER. A rapid point-of-care test gives doctors an immediate clue about what's going on, guiding their first critical decisions. At the same time, a sample is sent to the central lab for a much deeper dive. The data from both tests then flows into the patient's record, creating one complete picture for the doctor to make the best possible long-term decision. Now, this integrated vision, it sounds amazing, right? But it's not going to happen overnight. Building this kind of connected ecosystem requires new technology, new infrastructure, and frankly, a whole new way of thinking. So what's next on the to-do list? Well, first, we need all these devices and labs to actually speak the same language. Smarter connectivity is absolutely crucial. Second, all that data needs to be woven together into a single, coherent patient story. And third, we need new rules to make sure that a test done at the bedside is just as reliable and high quality as one done in a state-of-the-art central lab. This brings us to a really powerful way to reframe the entire debate. The central lab isn't disappearing, it's evolving. It's becoming the strategic hub in a much larger, faster, and more patient-focused network, directing traffic and handling the most complex cases. So what's the real story here? Is it a classic tale of disruption, where the old just gets replaced by the new? Or is it something more sophisticated, a story of collaboration? As we've seen, the future of diagnostics isn't about choosing sides. It's about building a smarter, more connected system that gives us the best of both worlds.
Like, share, and subscribe.